Scenario 1, abdominal aortic aneurysm, AAA. A 70-year-old male smoker presents with severe abdominal pain radiating to the back. On examination, a pulsatile abdominal mass is palpated. CT angiography confirms a ruptured abdominal aortic aneurysm with retroperitoneal hematoma. What is the most appropriate next step in management? A. Emergent open surgical repair. B. Endovascular aneurysm repair, EVAR. C. Observation and medical management. D. Angiographic embolization. Answer: A. Emergent open surgical repair. Explanation: in cases of ruptured abdominal aortic aneurysm, emergent open surgical repair is the preferred intervention to control hemorrhage, repair the aneurysm, and prevent further complications such as exsanguination and death. Scenario 2, acute limb ischemia. A 65-year-old male with a history of atrial fibrillation presents with sudden onset severe pain and pallor of the left lower extremity. On examination, absent pulses and coolness of the limb are noted. What is the most appropriate initial management? A. Emergent angiography with thrombolysis. B. Intravenous heparin infusion. C. Surgical embolectomy. D. Observation and monitoring. Answer: C. Surgical embolectomy. Explanation: in cases of acute limb ischemia with threatened limb viability, emergent surgical embolectomy is the preferred intervention to restore blood flow and salvage the limb. Thrombolysis or endovascular interventions may be considered in certain cases. Scenario 3, peripheral arterial disease, PAD. A 60-year-old diabetic male presents with claudication and rest pain in the right calf. Ankle brachial index, ABI, measurements reveal significant arterial stenosis in the right lower extremity. What is the most appropriate next step in management? A. Percutaneous transluminal angioplasty, PTAB, supervised exercise therapy. C. Antiplatelet therapy. D. Surgical bypass grafting. Answer: A. Percutaneous transluminal angioplasty, PTA. Explanation: for symptomatic peripheral arterial disease, PAD, with significant arterial stenosis, percutaneous transluminal angioplasty, PTA, with or without stent placement, is the preferred initial intervention to improve blood flow and alleviate symptoms. Scenario 4, carotid artery stenosis. A 70-year-old male with a history of transient ischemic attacks, TIAs, presents with recurrent episodes of transient focal neurologic deficits. Carotid duplex ultrasound reveals greater than 70% stenosis of the right internal carotid artery. What is the most appropriate next step in management? A. Carotid endarterectomy, CEAB. B. Carotid artery stenting, CAS. C. Antiplatelet therapy. D. Observation and medical management. Answer: A. Carotid endarterectomy, CEA. Explanation: for symptomatic carotid artery stenosis greater than 70%, carotid endarterectomy, CEA, is the preferred intervention to reduce the risk of stroke and improve long-term outcomes. Carotid artery stenting, CAS, may be considered in select cases. Scenario 5, varicose veins. A 40-year-old female presents with lower extremity swelling and prominent varicose veins. On examination, dilated, tortuous veins are noted on the lower legs. What is the most appropriate next step in management? A. Compression stockings. B. Sclerotherapy. C. Endovenous ablation. D. Surgical ligation and stripping. Answer: C. Endovenous ablation. Explanation: for symptomatic varicose veins, endovenous ablation techniques such as laser or radiofrequency ablation are the preferred interventions to close the incompetent veins and improve symptoms. Surgical ligation and stripping may be considered for refractory cases or specific anatomical patterns.